Good morning, good afternoon, good evening, everyone. Bonjour et bienvenue à tous. We already have over 100 participants. It's wonderful to see such a big group here. I'm sure some more folks will continue to trickle in, but we have a full schedule, so I think we'll get started. First, wanted to note that we do have French interpretation available for this webinar. So if you would like to listen in French, please select your preferred language. And actually, it's better for all participants to select their preferred language, either English or French, by clicking on the globe icon at the bottom of your Zoom screen. So I'll give you all a minute to do that, and you'll go into your separate rooms with your interpreters. Great. So welcome, everybody. I'm Erica Nybro. I'm the COVID-19 technical lead for knowledge success based at the Johns Hopkins Center for Communication Programs. We are thrilled to be collaborating with USAID and UNICEF today to host this really important conversation about COVID-19 integration into primary healthcare. I know that this is a topic many of you are working on and discussing in your countries and in your projects, and we hope to really shed some light on the operationalization of that work today. This is the first in a series of 3 webinars on this topic. Today's session will focus on global resources to support COVID-19 integration at various points throughout the health system, as well as some country examples and applications. Our session next week will take a deeper dive into examples of integration in service delivery and electronic data management in South Africa. And we are going to be soliciting input from all of you today to help determine the topic for the final webinar based on your needs, and we'll hold that in September. So without further ado, I'm going to launch right into some quick introductions of our presenters so that once we jump into their presentations, they can just run with it. We have several wonderful and incredibly experienced speakers with us here today. Beth Tritter is the director of the COVID-19 response team in USAID's Global Health Bureau. Beth was previously the director of USAID's COVID-19 Vaccine Access and Delivery Initiative and the senior advisor for policy engagement, coordination, and communications at the USAID COVID-19 Task Force. Beth will be providing opening comments in just a moment. Alba Villagilio has worked at WHO for the last 5 years. She is currently the technical officer in the Essential Program on Immunization at WHO headquarters, where she is also the focal point for integration of COVID-19 vaccination into primary health care. Previously, she worked as part of the COVID-19 response in the Western Pacific Regional Office and at the Pan American Health Organization in Washington, D.C. Benjamin Schreiber is a senior health advisor at UNICEF and is a deputy at COVID-19 Vaccine Delivery Partnership, the COVDP, as many of us know it, and is responsible for financing and demand planning. He has also served as UNICEF's Deputy Chief of Global Immunization Programs and Senior Immunization Specialist, overseeing the immunization supply strengthening work for UNICEF. And finally, Dr. Imran Mirza works as health specialist at UNICEF headquarters and is the medical doctor and epidemiologist. Since the start of the pandemic, Dr. Mirza has worked closely with WHO and partners in developing global guidance, technical documents, and supporting countries in the introduction and implementation of national deployment and vaccination plans at multiple levels. Dr. Mirza is a deputy to COVDP country engagement team co-lead and is now working on integration of COVID-19 vaccination in routine immunization and primary health care from the UNICEF side. So as you can see, we're in incredibly good hands today. I know these presenters have planned some really informative presentations, and we will also allow time for questions. Please put them in the chat, and we will take some breaks between presentations to answer some of those questions. So without further ado, I'm going to pass this on to Beth Tritter, who will be sharing with us the work USAID has been doing with UNICEF and WHO to provide support to this next phase of integrated COVID-19 activities. Beth, over to you.
Thanks so much, Erica. And I want to just thank all of our knowledge success partners for arranging for today's webinar. I also really want to recognize our colleagues at USAID, including Alexia Bishop and Emma Stewart, who've done so much to set up this webinar series. And also, we're extremely grateful for the participation of Alba, Benjamin, and Imran, our WHO and UNICEF partners. They have been such close collaborators through this response, and such dedicated global public servants, and we're really indeed very lucky to have them. As the COVID pandemic has evolved, our global response has evolved, and this moment is no exception as we increasingly focus on three intertwined priorities. The first, of course, is integrating COVID response into country health systems, and particularly primary health care, so that all countries are prepared to prevent and detect COVID and respond with treatment and care for those infected as part of their routine health services. The second is regaining ground lost during the pandemic on routine and essential health services, and particularly routine immunization. And the third is preparing to respond to the pandemic. For today, though, we'll focus on the first of these priorities and take a moment to go back in time a bit, as you see on the slide. Once COVID vaccines were widely available, there was a global focus on ensuring equitable access, largely through mass campaigns. In late 2021, the US launched Global Vax, a whole of government effort led by USAID in concert with CDC that focused on vaccinating people against COVID-19 in more than 100 countries, including 11 countries selected for surge support. Initially announced by the partners at a development ministerial hosted by USAID Administrator Samantha Power in December 2021, the COVID vaccine delivery partnership launched in early 2022 as a time-bound mechanism to support COVID vaccine delivery in those countries with the lowest coverage rates. COVID-EP brought Gavi, UNICEF, and WHO, organizations that were already at the vanguard of global COVID vaccine delivery efforts, together in a unique, coordinated way to support vaccine delivery at scale. Midway through 2022, the WHO SAGE updated their global COVID-19 vaccination strategy in a changing world guidance, which shifted our focus to high priority populations as vaccine campaigns continued. In early 2023, WHO and UNICEF have produced guidance to assist countries with mainstreaming their COVID vaccination activities into primary health care, immunization programs, and other essential health services. The end of the PHIC in May marked the end to the acute phase of the COVID pandemic and also solidified the need for these new tools and approaches to respond to this phase of the evolving pandemic. This new phase requires moving from mass campaigns for vaccination, which served an important purpose in rapidly reaching target populations, to a sustainable approach where COVID-19 prevention and response measures are integrated into primary healthcare structures. Next slide, please. The WHO UNICEF guidance brings us a common definition of integration and core principles to guide these efforts. At USAID, we've adopted this definition with a small change to reflect COVID programming beyond vaccination to include testing and treatment. The partial or full adoption of COVID-19 response activities across prevention, diagnosis, care, and treatment into national program services, including immunization programs, primary health care, and any other relevant health services, with the overall aim of improving program efficiency and sustainability, enhancing demand and improving user satisfaction, achieving and maintaining satisfactory coverage, and addressing inequities. We are fully aligned with the core principles of equity, people-centeredness, context-specific, and optimized service coverage. Despite the universal agreement on the need to integrate COVID-19 response into primary health care, we all know the devil is in the details, as they say. Operationalizing this integration will remain a challenge. Policymakers and health workers need guidance on the how to implement changes at different levels of the health system to achieve the desired integration. We're pleased to launch this webinar series on COVID integration, highlighting the tools and approaches that country-level stakeholders can use to answer this question of how to integrate. Next slide, please. I want to introduce a companion resource to the WHO UNICEF guidance that the USAID COVID response team has developed. The compendium of illustrative sub-activities for integrating COVID-19 response into primary health care can support policy and program managers in initiating and building on the integration process and developing a country-level COVID-19 vaccination integration plan. The compendium provides a systematic outline of illustrative sub-activities organized around the WHO Health System Building Blocks framework, similar to the UNICEF and WHO resources. An important element of the emergency response included expanding access to evidence-based, high-quality care and treatment for patients with mild, moderate, and severe COVID-19 infection. At this stage, activities should prioritize integrating evidence-based therapeutics and diagnostics into primary healthcare systems, especially the use of oral antivirals and test-to-treat programming, and ensuring sustainability of oxygen-related investments. The compendium includes a menu of options to integrate the test-to-treat approach as an important intervention in the COVID-19 response, in addition to vaccination-related strategies. Next slide, please. In recent months, COVIDP has been working toward what is next in COVID vaccine delivery, which is anchored on the details of integration and what is required at country level. USAID was pleased to partner with COVIDP and other partners to build on the initial guidance document in development of the integration mapping tools and related resources that you'll hear more about in a moment. These tools are exciting, and they are really aimed at supporting action toward integration at the country level. They're flexible enough to meet countries where they are on their integration journey. We hope they will be useful for countries at various stages of integration and thinking strategically about how to take the next steps in fighting COVID-19. I want to thank you all for joining us today. I'm looking very forward to hearing what our presenters have to say and to the ensuing conversation. We also hope that you'll join the future webinars in the series. And with that, I'll turn it back to Erica to introduce the next session.
Thank you so much, Beth. And your quick review of how far we've come since 2020, 2021 really strikes me. And I want to just remind everybody of the tremendous flexibility and creativity and quick action I think everybody on this call has shown, and really thrilled to be helping the conversation move to this next step. If you all have questions for Beth, please note them in the chat, and we're going to come back around to those after we hear from Alba. Alba is going to be walking us through the support package that WHO and UNICEF have created to support the integration of COVID-19 vaccination activities into routine immunization and primary healthcare services. So Alba, please take it away.
Thank you so much. It's a pleasure to be here today to talk about this important topic, how to integrate COVID vaccination into primary health care and the resources that have been developed by WHO and UNICEF to support countries in those efforts. Next. Today, I'm going to cover three main points. The first one being the importance of vaccinating against COVID. The second one, the technical resources that are available to support integrated COVID vaccination. And the third one, the benefits of integrating COVID vaccination into primary healthcare. Next. COVID vaccination effort does not end with the standing down of the public health emergency of international concern. Because SARS-CoV-2 is still circulating and certain groups continue to be at greater risk of severe disease and mortality. Those groups are mainly four main groups: the older adults. We do know based on data that the persons aged 60 years of age or older, they accounted for more than 80% of the overall COVID-19 mortality across all income groups. Adults with comorbidities or severe obesity, and also children, adolescents, and adults with immunocompromising conditions are also a high-risk group for severe disease, hospitalization, and even death. Pregnant women, data coming from a systematic review just published from last year, including more than 13,000 pregnant women, shows that there are higher risk of ICU admission, also ventilation, compared with non-pregnant women who got COVID. And also there is an increased risk of preterm birth and low birth weight. Also, WHO SAGE recommended to focus to increase COVID vaccination coverage for these high-risk groups and also healthcare workers, those that are in the front line. And the SAGE recommendation clearly says, and this is for March 2023, and it's in the context of Omicron circulating and also high level of immunity, that primary series as well as booster doses are really important for these five groups. And what should be the interval between the booster doses? So generally it's 12 months for older adults. Older, we refer, it depends on the country, it would be from 50 or 60 years old, adults with comorbidities or severe obesity, frontline health workers, while it should be 6 months for those that are the oldest ones. That it depends on how the country defines it, but it could be from 75 years old, multiple comorbidities, those that present severe immunocompromising conditions, and also those in long-term care facilities. What about pregnant women? So if pregnant women, it's more than 6 months in the moment that she's pregnant that has received the last booster dose, then it's time to offer another booster. And just a reminder, I would like to say that all WHO emergency use listing authorized COVID vaccines, they continue to hold the EUL status even after the end of the public health emergency of international concern. They remain to be safe, and also they protect well against severe disease and also mortality. Next. Mass campaigns allowed COVID vaccine to be the fastest delivery in history. More than 13 billion doses have been administered in a short amount of time. If we compare in this graph, you can see what happened with other vaccines that were available since 1990 until up to date, until the current year. So COVID vaccine, it's the one that really scaled up and was introduced in more countries in a shorter amount of time. And that has been thanks to the mass campaigns, which has been great being able to reach a lot of people in a short amount of time. However, because there is a however, mass campaigns have strained health systems. Health workers and resources have been diverted from providing essential health services. It's also estimated that mass vaccination campaigns are at least 3 times more costly than delivering the COVID vaccine as part of routine services. And in the current context, cost effectiveness and opportunity cost considerations become increasingly important. Right now, we're working with our health finances colleagues to try to define which is scenarios and what could be the cost of delivering the vaccine in different ways. Next. And what do we mean by integration? Because we do know that integration has different meanings and it's approached in different ways. COVID integration, and it has already been presenting the definition by Beth. So it's basically involved the partial or full adoption of COVID vaccination into primary healthcare services, as well as other health services. And for that, there is a need to consider integration by considering the health system building blocks. What I mean, and it's not only about co-administration or co-delivery with other health interventions, it's also about thinking how we can leverage leadership governance bodies from other antigens, other vaccines, or other health interventions that could be used for the purposes of integrating into PHC. Also in terms of funding, health system financing, demand and community engagement, service delivery, as I said, and I will talk more about it later, the health workforce, and the health information systems, how to leverage what was developed for COVID, for example, electronic registers, to be able just to strengthen routine immunization systems and primary healthcare overall. Next. And there is funding available. The Gavi board just approved at the end of June that there will be funding to support the COVID vaccine for 2024 and 2025. So the main objectives that are part of the Gavi funding are the first one, referring to maximize the health impact by continuing to support COVID vaccine delivery for high priority user groups, the ones that I just referred in my first slide, the 5 main groups: the elderly, pregnant women, people with immunocompromised conditions, people with comorbidities, and healthcare workers. These are the 5 groups. And then the second objective is the objective about integration, how to continue to support health system strengthening and integration of COVID vaccination into routine immunization, primary healthcare, and other healthcare services. So what it means that it's basically, there are 2 objectives and it's quite broad. So we're moving to not only focusing to immunization, we're also focusing on health system strengthening. And who is eligible, who's in the scope? So 91 91 countries are eligible for the support for 2024 and 2025. And there is a distinction here between the ones that are the Gavi eligible countries, the ones that they say we refer to them as Gavi 54, which are eligible for a full vaccine procurement. So 100% of the cost of the vaccine, COVID vaccine, without co-financing obligations. And they're also eligible for delivery support through the existing COVID vaccine delivery support resources. From now on, I'm going to refer to them as CDS. For COVAX AMC countries, we refer to them as AMC 37, so 37 countries, they're eligible for 50% of the procurement of the COVID vaccine, and also they can leverage the CDS resources. The amount that hasn't been used of these CDS resources in 2023 that could be used for 2024 and 2025, it's more than 300 million. Next. Moving towards the technical resources that are available to support this integration. Next. So the main question that we're still hearing from countries, and it's the most repeated question, is how to do so, how to integrate. This is so big. Where do we start? So there is a support package for countries that consists in different complementary materials. The main material is the guidance that has been mentioned also earlier today by Beth. And this WHO UNICEF guidance proposes 4 steps for integration. The first one, initiating building on integration. And for that one, there are 3 main actions that are proposed. Benjamin and Imran, my colleagues from UNICEF, will talk more about that, but just to say that these 3 things are: first, engage with relevant stakeholders. This needs to be a multidisciplinary, multi-sectoral approach beyond immunization. The second piece is to explore funding resources, funding opportunities, and Gavi, as I said, it's one option to be able just to continue planning for integration and implement it. And the third piece is to self-assess and see where you are as a country regarding integration. And for that, you can see that there are several tools that have been developed. In the slide, you see B as integration mapping tool. I will talk more about it in the next slide. And also there is the readiness assessment checklist. Finally, as part of the support package, there is the implementation support materials, which are basically a lot of country case studies, more than 40, to be able just to say by health system building blocks, how the countries have on ad hoc basis, or maybe more on a planned way, integrated already COVID vaccination into their systems. Next. I'm now focusing to define as part of this step 1, we say that one of the things to do is to assess what's the readiness, what's the status. So there are 2 tools that are available. The first one is the readiness assessment checklist. This checklist is part of the WHO UNICEF guidance, and it's available as a PDF or as a Word, and also in an Excel sheet. So having the same questions and being able to respond yes, no. And being able to identify what are the main actions that need to happen by health system building blocks. The main primary users that are expected for this tool are technical focal points, but technical focal points in all the different health departments, not only immunization. And the outcomes that provides, it's a list on actions to be by health system building block to be able to develop a specific, a detailed integration plan. To date, it has been used by more than 30 countries, and there is no need for external support to implement it. It could be used at national level, subnational level, and it's really straightforward. There is also another tool that is called the integration mapping tool. This mapping tool, it's more high level. It provides the opportunity to do a situation analysis and assess the current state, and it's more for high level stakeholders. In terms of outcomes after the completion, it provides a heat map and also a visualization that it's easier to see in which health system building blocks there is a need to put more effort. To date, it has been piloted successfully in 1 country, and other countries have expressed support also to use it. They're both available online as part of the support package, and since these slides are going to be distributed, you will be able to click and you should be able just to download them. Next. I talked about step 1, now I'm moving to a step 2. And the step 2 is about planning and developing a country integration plan. And we developed the the guidance in 2022, we were talking about plan, but now we're realizing based on the experiences of countries, it could be a plan, it could be a roadmap, it could be a document. It depends on the countries. They have decided and they're moving towards integration already, even not having a clear, detailed plan. But there is a need for this step 2 of different actions, are the ones that I'm detailing here in 4 bullets. The first one, there is a need for the Regional Immunization Technical Advisory Group or the National Immunization Technical Advisory Group, the RITEC or the NITEC, to update the COVID vaccination recommendations based on the latest WHO SAGE roadmap that I presented at the beginning of my presentation. There is also an opportunity to identify other health interventions that can be provided specifically to these high-risk groups. And these high-risk groups are mainly adults. So this is a change from childhood vaccination to really focusing on adult health services. And in that, I would like to leverage examples from Panama, where since early in COVID vaccination, they decided that for them, since COVID vaccination is right now recommended to the same age groups as influenza vaccination, to do co-administration. So in one arm to provide COVID vaccine, in the other arm to provide influenza vaccine. And they were doing that at health facility level as well as house to house. It's also a time to decide which delivery approaches and to consider moving away from mass vaccination campaigns that, as I said, they could be costly to health facility-based administration or provision of different health interventions. And for that, since we're talking about adults, we have to figure out where to find them. Where do they go? It could be through non-communicable disease services, or maybe HIV and TB clinics, or ANC services for the case of pregnant women. In the case of Tanzania, and just to give you a snapshot, also, in order for them to be able to achieve high vaccination coverage in specific immunocompromised groups and also with people with comorbidities, they decided to partner with HIV services to provide COVID vaccination when the patient was going there, and also with other physicians who are treating other chronic diseases. Also, the other point is to consider what other investments need to be done in order to be able to integrate, and that should be considered by health system building block. It could be maybe healthcare workers training. It could be to update national guidance, for example, include COVID vaccination for the national guidance for pregnancy follow-up, or it could be to update and integrate COVID vaccination in information systems. Next. And the most important thing, what are the benefits? We talk a lot about the benefits on an individual basis, considering like what would happen for morbidity and mortality for these high-risk groups. But what about other benefits? Next. Integrating COVID vaccination with other services increases the opportunity for a more people-centered approach. And WHO just recently published, and my colleague Shalini Desai is also connected here today. She coordinated the guidance that you can see on the left of the screen for vaccinating older adults against COVID. And in that guidance, what it's provided, it's a table with the idea to be able just to map where COVID vaccination could be provided, what are the integration opportunities, and also what is the potential cost. So what you can see in the left, it's from fixed healthcare facilities to long-term care facilities, community outreach, and also mass campaigns. There are different options how this could be provided. But if we think about the idea of health facility base, we see that the cost is expected to be lower if supported by the healthcare budget in comparison to other delivery approaches that could be more costly, for example, the mass campaigns, because there will be a need to create another infrastructure to be able to probably have other healthcare workers or hire them to be able to perform per diem. So other aspects that could increase that cost. And also they have an effect in the routine health services or essential health services. In terms of integration opportunities, we know that if we provide it at health facility level, and there are specific countries that they are already doing that, there is an opportunity to provide influenza vaccine or other vaccines recommended for adults and elderly, and also maybe to provide other health interventions like the screening of non-communicable diseases like hypertension, diabetes, and also potentially, if we're aiming to provide better services, better care, then probably more elderly population might go to the health facility. Next. COVID vaccine as a life course immunization approach for existing and future vaccines. And what do we mean by that? So in this slide, which looks quite busy, you can see from pregnant women, newborn, infants, second year of life, children, adolescents, adult, and older person. So we see all ages. And then in the boxes in white, you see the vaccines that are recommended for these groups, the specific vaccines that are recommended. On the first row, the ones that for all populations, regardless the characteristics of the population, and then in the second row, the ones that could be in a specific cases for specific characteristics. But what I want to highlight is that COVID in red, it goes along all ages except newborns because there is no vaccine available, but for pregnant women and from infants to adolescents, for those that they're immunocompromised or they present comorbidities, and then for adults and elderly. And also then I want to highlight in purple are the vaccines that are in the pipeline, future vaccines. There are several vaccines that are in phase 3 trials for pregnant women. It could be respiratory syncytial virus or group B streptococcus, what we call RSV or GBS. For newborns, which RSV, it's definitely one of the main causes of pneumonia, RSV monoclonal and also tuberculosis next generation are vaccines in the pipeline. And then for adults, one of the vaccines, it's also tuberculosis next generation. So the idea that if we're able to build these adult immunization platforms, we should be able to better introduce and faster introduce the vaccines in the pipeline. Next. And building delivery platforms for adults also contributes to increased pandemic preparedness and response capacity at country level. And here, what this slide is presenting, it's if we consider that influenza vaccination as well as COVID vaccination, they are now targeting the same 5 high-risk groups that I mentioned at the beginning of my presentation. LMICs with influenza programs reach higher COVID vaccination coverage more quickly than countries without influenza programs. So what the graph is showing in blue or in gray, it's that 12 months after introducing vaccines, in this case a COVID vaccine, those countries that had influenza vaccination reach an average of 47% coverage of the total population with primary series in comparison to 22 of the countries without influenza programs. Next. And this is my last slide, and this is the key messages. So COVID vaccine was the first vaccine routinely offered to most adults. As a reminder, more than 5.5 billion adults, 5.5 billion adults were reached with COVID vaccines and provided lessons on how to deliver vaccines throughout the life course. And this is totally aligned with the goals of the Immunization Agenda 2030. Reaching adults and moving away from mass vaccination campaigns requires a mindset change, and a mindset change at all levels, including healthcare workers, and engaging with other relevant health programs, services, non-communicable diseases, HIV, TB, ANC. Building these adult immunization delivery platforms contributes to strengthening primary healthcare and also UHC, and to better pandemic preparedness. And finally, I just want to say that this is about people. This is about how to better protect and how to better we offer health services to adults. And we, WHO UNICEF, remain really committed to support countries to integrate COVID vaccination into life course immunization programs. Thank you so much.
Thank you, Alba. That was so much information. I want to point out that we have also dropped the links to those materials in the chat. So if you are eager, please feel free to click on them right away. But we will also be sharing the slides after the webinar with all of the links. While we gather some questions for the presenters thus far, we want to hear from you. We're going to launch a couple of poll questions just to understand better what you are doing in terms of integration and where you are. These are anonymous, so just take a quick minute and respond to the questions, and we'll come right back with Q&A. And they are here in both English and French. We're first asking if your country has used the self-assessment checklist or the mapping tool. And then secondly, we're wondering if your country has defined next steps towards integrating COVID-19 vaccination, so some type of action plan. let's see where we fit in these. Great, thanks so much for the responses, and you can continue to respond, but it looks like about half of the participants don't know if their country has used the self-assessment checklist or mapping tool, which is totally understandable. About 30% have used it, and then a group have not. So that's really helpful for us to know. We hope that those of you who have not or don't know will check out those resources. And then the second question, whether or not you've defined next steps towards integration. Interestingly, this is much higher. It sounds like people are very action oriented. So that's great. About 60%, and that's out of 100 of you who have responded. So thank you, have indicated that you do have some next steps towards integrating COVID-19 vaccine. And I hope after today, maybe you have some more thoughts about how to do that. Great. I think we can end the poll and move to some questions. I figured I would start off with a question that I have, and I think some others on the call might have, which I think Beth or Alba could speak to, and probably Benjamin and Imran later. But I was wondering if any of the presenters could talk a little bit about how countries who are at very different stages might still engage in this integration discussion. It's my understanding that, you know, the goal is not necessarily to do everything in all health area and be integrating 100%, especially if folks are sort of more at the beginning of the process. So I was wondering if you could just reflect on that so that everybody on the call has a sense of where they might fit in this conversation, regardless of where they're starting from.
Sure, of course, happy to provide a bit of, and the way that we define integration, it's not that integrated, no integrated, it's not black or white, it's more like a continuum. So basically you kind of start from the high risk groups, and to see based on that, maybe you can even select for which ones of the high risk groups you would like to start thinking how I'm going to be able just to reach to other services. For example, let me use an example, pregnant women. So pregnant women, we do know that usually they go to ANC services for their routine pregnancy follow-up. So maybe that's an opportunity to be able to engage directly between EPI and ANC and see how we can work together to be able just to deliver COVID vaccines and offer COVID vaccines as part of the routine follow-up. That could be one way, that could be a starting point. But also other countries are more advanced, and for them, those that, for example, they haven't already vaccinated against influenza for many, many years, for them it's more like a matter of how to add COVID vaccine as one more vaccine. And there are a lot of countries in Latin America that are already at that stage, but maybe it's time to think, what about information systems? Is there a way that we could think about how to also be able to register on an electronic basis COVID vaccination with the rest of the routine vaccines, how we can include that as part also, not only about vaccines, but also as part of the all health medical records of that person? Can we think more broadly? So there are different ways that this integration is relevant, and the WHO UNICEF guidance just opens and the opportunities to see, depending on where you fit, to go further or less. I hope that helps.
Just very briefly, I also just want to build on what Alba was saying. She's absolutely right. This has to be context specific. It's really a continuum. There's no one size fits all expectation that everyone's going to sort of reach a level of integration after a certain period of time. It really very much depends on where the country is right now and what their specific strengths and challenges are. I think what I'd say is that This is also a multi-sectoral effort, just as much as, you know, primary healthcare. One of the three pillars of primary healthcare is multi-sectoral action. I think one of the key principles of integrating COVID-19 response into primary healthcare is looking around at how you can use the various sectors in a country. Are there sectors, for instance, that reach elderly people with pensions or other services that you can tap into to reach those folks for high priority vaccination, right? It doesn't all sit on the shoulders of the vaccination effort, of the current vaccination effort in a country. And I think it's really important because, as we've seen, as Alba so aptly described, you know, the run-up in COVID vaccines, which was truly breathtaking, really did have an effect on the availability of personnel and resources for other parts of the health system. And so, as a way to not tax the health system as much going forward, you really do want to look at what other sectors you can tap into as partners to reach these high priority populations, because they're existing as people, not just as patients, right? So that's one thing that we really want to encourage. And I see that Imran had a comment as well.
Thanks, but no, I think you have already mentioned that one, because countries has a very best opportunity at the moment that they can see where they have challenges and risks in their health systems of delivering of the services to the populations and how they can integrate. Because challenge what we are seeing in the countries, most of the immunization programs focus on the children. So but integration of COVID, when we are talking about the COVID vaccine, is beyond children, is adult groups. And that's a different total thinking that normally what we put a question to the ministries and the governments that think that if a 70-year-old person comes to the health facility for his normal diabetic checkup or for his TB treatment, what systems are in place in the health system that person will be screened if that person has received the vaccine or not, COVID vaccine, and if they have not received, how that person will receive the vaccine. So it is not a one-off activity, it is building a part of the system. Same example like Alba given for the pregnant women. We have seen in many countries, pregnant women, they do come to the facilities for the ANC visits. But if you compare in the countries, the number of the ANC visits comparing the TT vaccine, what they are supposed to receive, is a huge difference. So means there is somewhere problems in the system that even the persons are coming to the facilities, they don't get the services what they are supposed to get. So if we can address and see, countries can see what are the challenges, how they can address, what changes they need, and not only changes in the immunization strategies, but they need to think what changes they need to make in the health system strategies also. Over.
Thank you. I want to note that we're compiling questions, and a number of the questions coming in I know are going to be addressed in the next presentation or might be better suited for Benjamin and Imran, so I'm not going to ask all of those. But Alba, there's one that perhaps you or somebody else from WHO might be able to respond to. And the question is, will countries and RI tag and ITAG benefit from external TA services support for the planning and deployment of the integration? And I know this is perhaps a hard question, but I'll see if you can take a stab at it.
Well, I would say that it really depends on the country and the strength, how strong it's a NITAG there. And also if even there is a functional NITAG or if they have to rely on a regional tag. So what I would say is that there's a global network of NITAGs. We are providing materials through the global network on COVID vaccination with what I'm saying materials, apart from the guidance, which is a document, but also specific slide decks that could be used to inform the discussions that will be happening at country level about which groups to prioritize and also how often they're going to be targeted and how to do so. So there is TA that could be provided at the country office level, that particularly the WHO, UNICEF, we do have country offices. There are also implementer partners that could support the NITAGs if needed. And then also there are specific materials that could support them also to make these types of decisions. But in any case, if there is a need for a specific TA, please reach out to us. We'll figure out through our 3-level way of working who is in the best position to be able to support your country in making these decisions.
Thanks, Alba. In the interest of time, I think we're going to move on, but I would suggest if Alba and Beth could take a look at the questions in the chat, and if there's any that you can directly respond to, that would be great. If not, I think many of them are going to be covered in this next session, and we have more time for Q&A after that. So now I'm going to turn it over to Benjamin Schreiber and Imran Mirza from UNICEF, who are going to be sharing the current status of integration and some country-specific examples of integration. And I think this will get at some of the questions we're hearing about, the conceptual framework versus really how-to application examples. So Benjamin Mirza, over to you.
Thank you. I hope you can hear me well. And thanks for the great participation, over 200 people by now. It's really thanks for joining us and following this, and please come in with some good questions. I start off, before we start with the first slide, with a few comments. Integration is easy on PowerPoint, but it's difficult when you are at the country level and you need to actually implement this. The EPI program is also a fantastic program that has very strong cold chain logistics capacity to bring the vaccine to many places in the country. But integration means, as Alba said early on, you have to give these vaccines probably into the hands of nurses that have different touch points than focusing on children, because they will treat people who are immunocompromised or persons suffering from diabetes. So this aspect of moving the vaccine out of the cold chain and maybe into the hands of people of different programs, of different nurses who are working different programs, that is what we have to tackle here. In the moment, we have a great opportunity. There is experience, there's fantastic experience across countries. I hope we can highlight this. There is political momentum because the COVID-19 vaccination needs integration to move forward. We cannot rely on campaigns anymore. And also, as Imran will highlight later on, there is an opportunity here because there is funding from Gavi. So that's unique, because before we talked about integration, but we never had funding actually, and that's also important. I will highlight a few important points that we learned from having worked with a fantastic team in Côte d'Ivoire. And I will summarize a few key points now from this country mission that we did. So next slide. And I don't have many slides, so I only have 3. But I think there's a few key messages I want to pass across. It is really important that when you work at the country level, you get the right people around the room to discuss integration. And that's actually more difficult than sometimes, and getting commitment about this. That's probably more difficult than actually looking at the guidance and looking at the technicalities of integration. So what's really important, what we learned, and in Côte d'Ivoire was really great. The Ministry of Health hosted a meeting, high-level meeting, to start this work, and also ensured that all the different stakeholders that work on immunization, primary health care, nutrition, etc., they were in the room and supported this work on integration. The second point is really this high-level political support and commitment. The EPI by itself cannot integrate. It needs the other programs to be to work with the EPI. And this is why it's important that there's high-level commitment, so that all the different health programs that you can integrate into and work together with are around the room. And that requires really high-level political support and leadership. And that's where the Ministry of Health and the Cabinet and all the high-level decision makers in the Ministry of Health are so important. And the third thing we learned is having these guided discussions. actually discussing what does integration mean concretely. Yeah, what does it mean for the data systems in the country? And every country has a different data system, different context. But what does it mean concretely now? What does it mean concretely about training different stakeholders and different nurses that work in different programs about the vaccine? How do you really engage now the communities comprehensively? So really spending time and have guided discussions, bring in diverse groups of people, different perspectives. That's really helpful because the country colleagues will know the context best, and they need to discuss what is possible, what's not possible, to define sort of a roadmap moving forward. So here, these are really the 3 lessons learned. And next slide, I go into a bit more detail on some of them. So the representation is important, like I said. You need, of course, a leader from the government. That's really, really important. But like I also said, different programs need to be participating. Of course, you have the EPI, but you maybe have the primary healthcare program, malaria, TB, HIV, maternal and newborn health, etc. So every country has their own programs. It's really important that they participate of the process. Some countries also have their specific COVID-19 task forces, so these can be leveraged. But we found that in Côte d'Ivoire it was really great because many of the programs participated in the discussions and provided a lot of concrete input. Then there's non-government representatives. You have, of course, national stakeholders, WHO, UNICEF, immunization officers, but not only those are important. You need to maybe also link in the colleagues that work actually on primary health care, malaria, etc. Gavi as a contributor providing vaccines and financing is also relevant stakeholders. And then, many here from you work for USAID, work for technical agencies. All of these implementing partners are really important to loop in and get involved and spend. So our lesson learned is like, it's important to spend time to design this engagement process with the right stakeholders. Next slide. So we did some in-country missions, and here's some summaries of what we think worked kind of well. As Alba did, we spent time to introduce the whole integration package, highlight the latest SAGE guidance, etc. And for the country to also prepare on their side, what are they already doing in terms of integration? What plans they already have in place? What are the budgets? Who is working on it, etc. And then kind of have targeted discussions, 15 hours over 2 or 3 days to discuss this. So maybe if you go to the next slide, that outlines a little bit of an agenda. So it's much more like sort of how to do it. And of course, I mean, that needs to be adapted to the country context, etc. But kind of having a high-level kickoff meeting with the Ministry of Health to get the support, political commitment from all the key partners before you then actually do the much more technical discussions around the local context, describing the integration support package, there's understanding the SAGE recommendations, what do they mean for the country context, and then we introduce filling out the mapping tool or the other tools that are available. The country can choose whatever they want, as long as it kind of, you have a discussion around it, what it means. So I think we are very tool agnostic as long as the country has a good discussion around what it means to create. Then that's the next day, sort of starting to develop an implementation roadmap and come up with some sort of clear solutions and implementation plans. And then kind of you go back to the Ministry of Health and do a restitution of the key work and represent back the work that you've done. So you've got political commitment, and that's kind of important because it's not, and that was maybe to the previous discussion, integration is not a one-off piece of work, it's ongoing work. You will start integrating with one program, later on maybe with another program. And in some countries, some countries are at different stages. So some countries can maybe do much more initially than others, but it's a journey and it's complex and takes time. And I think the with the question to TA, we think in some countries, absolutely it's necessary, but also leverage the very strong in-country processes, working groups that already exist and that, they can do a lot of work as well. So if the country requests TA, absolutely, but also let's leverage what's already there. Next slide. And that was it from my side. Over to Imran.
Thank you, Benjamin. So I will share some of the things what we've seen in multiple countries. As is mentioned, integration work has been started in the countries, is a kind of different thinking and approach. So countries are on weekly basis, things are changing in the countries, they are improving their plans, they're working on the plans and the activities. Next slide, please. We have done some of those mapping tools, and we found that on the different health system building blocks, some countries has limited integration planning, some in the leadership and governors on the different system blocks. Some countries have improved a lot on the health information systems. For example, what they have done is that for the COVID vaccine, they developed a follow-up system in their DHIS2 that people were followed up if they have not received the vaccine. So now they are integrating that system, which was purely developed for the COVID vaccine. They are putting it as a part of the regular DHIS2 and using the same experience to follow up the children who miss any routine vaccinations. So this is how they are building those systems which were developed for that one. Some countries have seen that they still have overall capacity constraints in the health workers. So they are saying that people who were part of the COVID response, how the countries can bring them on board in the health system so they can provide the different things. So different countries are doing the different things in the different health system blocks, and they are seeing improvement that what else they need to do it to go to the further or improve more things for integration in those things. Next slide, please. So the three main observations we see from the country missions is focus on integration into the EPI. Some countries are still thinking on the EPI side, as mentioned by Alban, Benjamin, and Beth also, that integration is beyond EPI. So that is still required at the high senior level, that how we can reiterate importance of consideration of non-immunization programs. Like even there was a question on the NITEX also. So even in the NITEX, we have to think how we can bring non-EPI people in the NITEX or in the ICCs with the countries. So that's how we can bring non-EPI people for that integration and then develop those strategies and the policies and the systems in the countries. So it can be the malaria, TB, NCDs, those people can also be reached. Updating target populations, as mentioned, that COVID focus of the recommendation from the SAGE is to reach the adult populations, people with the comorbidities and those ones. So how we can target population, and the challenge some of the countries are facing in reaching those populations, identifying those populations in the rural areas, those ones. So that countries has to think that what is the number of the people who are elderly or people with a comorbidity, from where the data can be collected and how they can be reached. Also, scoring based on the overall systems are evaluating their own systems, because this is a good opportunities where countries can evaluate where are the system blocks or the challenges, and through the integration of the COVID-19, how they can address some of the system blocks. And they may not be able to do it everything, but at least which is easy to do it, so they can do it now in the short term, and then what they can be doing in the long term things. Next slide, please. In end of May, as part of the COVID vaccine delivery partnership sunset, we organized a stock take event, in Addis Ababa and Ethiopia, where more than about 34 countries participated and about more than 170 colleagues from the countries who participate in that. And for 2 days, we reviewed how the COVID vaccine rollout happened and then what they are doing on the integration. So around 30 participant countries shared their self-assessments, which has been done either using the checklist, which was shared by the ELBA, or a mapping tool. And they came up with that what they are doing in the different areas. So in a nutshell, because as I said, countries are still working on that one. They are changing their plans, they're changing their activities. Till now, majority of the countries are still doing opportunistic integration is taking place, which means they are still doing kind of one-off either the integrated campaigns or only integration with the EPI. And we are saying that it is, but very few countries are working strategically with the non-EPI programs. For example, HIV, TB, non-SID. There are very few countries who has developed their plans and they start working, integrating with the other PSC programs, but still a majority of the countries are thinking on the short-term ad hoc activities, which we call it opportunities. So that's, we are still working with the countries. We are trying to provide the support. There are about 4 or 5 countries in East Africa who has planned stakeholder meetings and the discussions on the integration in the coming 10 days. So they will be working on that one. So that's the message we are trying to convey, that integration of COVID-19 is not only one-off activity. It is building, helping the system development, as Elba mentioned, is helping building the adult population platform, that in future, if there's a pandemic, then if the platform is there, then it will be easy for the governments and the ministries to reach those populations. Or using the immunization adult vaccination platform as a vehicle, those populations can be reached for other non-EPI activity of the services also. So it's not that only EPI vaccine is given to the adult populations, but other services can also provide it if the platforms are there. Next slide, please. Regional offices, both WHO, UNICEF regional offices, are tracking status of integration. As I said, so this is a current update as of July, that different countries are in the different phases. They are developing the integration plans. Some countries also have integrated into routine EPI and PSCs. Around 6 countries has fully integrated into the routine. Other countries are still thinking. There are countries who are thinking of integrating COVID-19 data into the routine systems. As I mentioned, some countries working on how they can integrate as part of their regular DHIS2 or HMS systems. So different countries are in different phases and they are working on them, how they can further integrate in the various activities. Next slide, please. As was mentioned, that the funding is available from the Gavi and as a part of the CDS. So a lot of countries, about 61% countries reporting benefit, and 36 countries reported to date that some of the countries, they have upscaled their cold chain infrastructures. Like Ghana and Malawi, they procured more refugee trucks or the vaccine cold chain equipments. Some countries have using the digitization of the health data, like for example, Uzbekistan, South Tome Principle. They are working how they can include it as part of the electronic immunization registries or the part of the DHIS2. Some countries has combined their COVID-19 into the routine delivery platforms, like Tanzania and Kenya are trying to do it. There are some other countries of for example, Sierra Leone, they try to give COVID-19 as part of the HPV program in their schools while they were reaching their children. Some countries are expanding their supply chain capacities. And we have examples from Nicaragua, Angola. So as you say that some of those majority of the countries, they are doing where in one areas or small areas of the health system block. So this is a revolving situation. Countries are still working and increasing their more things where they can integrate and build up their systems using this COVID-19 integration funding, which is available, and the support which is available. Next slide, please. During our workshop, we also find that countries are facing some of the challenges, the risks. The main challenge, I think was also raised by one of the questions, is as the public health emergency is declared over, there is a rest demand and risk perception from the countries. And that is that the demand is going down. So more efforts are required to explain to the communities and the governments that the COVID, although the emergency is over, but the risk is still there. And especially for the high risk populations, which are focused for the SAGE, the elderly population, the people with the comorbidities, pregnant women, they are, or the health workers, they are still at risk. So we need that COVID vaccine for the booster doses and also to reach those aims. So that efforts will still be required to keep that demand and improve the risk perceptions in the countries. As I mentioned, we have still seen that there still most are the opportunistic integration efforts are going on integrated campaigns. And we saw from the ELBA, these are very expensive campaigns. Countries cannot afford continuing those integrated campaigns. So we need to build up more strategic approaches of integration in the primary healthcare system and the routine immunization systems. Further efforts are still required to advocate, create understanding among partners. And this is also, as I said, it is beyond immunization. That integration is beyond service delivery. It also includes strengthening the systems, building the life course approach as part of the universal health coverage agenda, as part of the community-based systems in the countries, as part of the SDG efforts in the countries that to reach those equity of the populations, that how countries can think that they can use these immunization platforms to reach with other services to these high-risk populations along with the COVID-19 vaccination. And the last one is also to collaborate with coordinate with the PSC stakeholders, including HIV malaria. We have seen in countries that still have started doing the integration, but all the HIV, TB, and other non-communicable disease programs are not part of it. So what we are recommending countries, and some countries start thinking of that in their ICCs where the immunization people take the decisions, how the non-EPI stakeholders can become the part of that one. In the NITEX, how they can bring it, and where, because this is beyond immunization. So that's why we are saying that how the non-immunization stakeholders can become the part of those collaboration and coordinate for these efforts, because integration is PSC, it is not with one, the clapping is by the two hands. So not only EPI, the non-EPI people has to become collaborate with the immunizations. Next slide, please. I think that was my last one. Yes, the last one. So there was the questions, what kind of support is available? As mentioned, ELBA, the country support package, the guiding tools, trainings, those things are available on the TechNet and from the WHO sides, from the WHO, UNICEF, and the other partners, technical assistance is available if the countries need that one. Regional offices are taking the lead in providing technical support to the countries. But if any country needs further technical assistance, they can contact the WHO, UNICEF, Gavi, or other partners in which area they need the support. So technical assistance available. And also, as mentioned by Alba and Benjamin, Gavi funding is available with a new program which has been approved by the board for the next 2 years. And the countries can use the CDS3 funding or the fundings which are available. And not only the Gavi, there are a lot of fundings available from the other donors also in the countries. So colleagues, the ministries can explore what other fundings are available in addition to Gavi in the countries from the World Bank and other donors, and how they can use those fundings for this integration efforts. Next slide, please. I think this was my last. Thank you. Over to you, Erica.
Thank you so much, Dr. Mirza. There is such robust conversation going on in the chat and a lot of questions. We won't get to it all today, but I do want to comment that this is a series of 3 webinars. Some more of these topics will be taken up next week, and these questions and comments will really help us determine what to cover in our 3rd webinar. So please rest assured that there are ways that we may be able to answer some of your questions in the future, even if we don't quite get to them today. I did want to start with a question for Dr. Mirza that I think is on several people's mind. And one is that, integrating COVID and routine immunization can be hard because there are such different target populations, in that most routine immunization is given to children who hopefully don't have comorbidities. And so sometimes it seems easier to target, those groups separately. So is there any advice on how to handle that? And that's coming from Mormon Gati in Lesotho.
Thank you. No, good question. There are few countries who has done again, they did a campaign, integrated campaigns of COVID-19 with the measles and other ones. And so that was, again, it was a campaign which is expensive. It cannot be sustainable. And even in the campaign, what they did, they added few more vaccinators in the teams. And when the teams reached to the communities, the children received their measles vaccines and other children vaccines through the one team, and the additional vaccinators provided COVID vaccines to the adult populations and those ones. And plus, what they did is that they involved the community health workers. So they always raise awareness in the communities that team will be coming, and they identify those adult and high-risk populations. Yes, it is difficult. So that's why we are saying that every country has to think how they can reach. One of the countries are doing, like Tanzania, they have involved community health workers. So community health workers in the communities, they are identifying high-risk populations, and they are linking those high-risk populations with the immunization team. So when they come for their routine immunization outreach activities, they know that they have to bring COVID vaccine, and these are the people in those communities who will be given the COVID vaccines. So some countries are coming up with their new innovations and those things. Every country has a different approach. Every country has a different situation, depending on the geographical and those ones. So it is difficult. We are still gathering information from the countries, how they are doing. But this is some other thing. In the health facilities, it is much easier, because when these high-risk populations are coming to the health facilities, they are in the health facilities. So in those, some countries are building systems of referral systems in the health facilities, that when this high-risk population comes in for any checkup, anything, the system should be there to screen them, and then they get the vaccine. Thank you.
Thank you. Benjamin, did you want to add?
Yeah, I think Imran did covered it well already. I think it's a really good question. I think the key message from our side here is integration into just routine immunization is necessary, but it's probably not enough. You need to also integrate and work with the other programs that have different touch points. They touch different populations. Yeah, so leveraging this. So and that is very context specific, but the EPI is a great program that brings the vaccines to children, to many locations, etc. But it's not often, it's a mother and a child that's showing up in the health facilities. It's not the grandfather, but the grandfather maybe needs the vaccine. So how do you get and reach out to the grandfather of the child, and which programs have touch points with that grandfather, so you can make references with it, make referrals, or you reach out to these with targeted outreach. So I think these are the things that need to be put in place at country level, and that's why focusing only on EPI, it's necessary, but you probably need to go beyond that, and then these are the specific questions that need to be solved. Over.
Thank you. This may be a bit of a follow-up, but I wanted to ask, Laura Shimp noted that given the implications for continuing life course vaccination, can you speak to what is being done to help country EPIs longer term to update their policies and programs for life course vaccination, given that many were primarily founded with a focus on infants and pregnant women?
Let me add that from the UNICEF WHO side, we are working on supporting the countries in revising their immunization policy strategies. But as I mentioned, this integration is beyond immunization. So it's not only the revision of the immunization policies, countries has to start thinking revision or revision of their health system strategies and the policies also. Because if we only do on the immunization side and the health system things has not been done, then again, there will be still problem remain between the primary healthcare and the health systems and the immunization. So there are regions and both organizations are supporting countries in reviewing their revising the API policies. Over.
Thank you. Alba?
Thank you. I think it's a great question from Laura, and I think it's super relevant. And I think we should all learn from the COVID lessons, and because this has been the main time in history, basically, that so many adults have been reached by vaccines. And the idea that from healthcare worker level up to the global level, this is a change in the mindset that vaccines are beyond childhood. Vaccines are for all of us. All of us, we should, or there are vaccines that are recommended for us, regardless of the stage of age or the stage of life that we are. So the idea is starting from the curriculum for the healthcare workers, starting just to really frame the vaccines as a life course approach, that could be a starting point to be able just to then generate a demand by the groups, for example, pregnant women, to know that there are vaccines recommended and being offered to them and how important it is. But the same for elderly and the same for other groups. At the same time, I mean, at global level, regional level, the immunization agenda 2030, one of the main goals is the life course approach, with the idea to be able to build the adult immunization platforms, particularly for healthcare workers and also for adults and for pregnant women. And at regional level, there are efforts right now being with the idea to develop specific regional plans on how to really move from childhood vaccination to adult vaccination. We understand that this won't happen from one day to another, but we should definitely leverage the lessons and the legacy and the momentum of COVID to be able to shift that way of approaching immunization. Thank you.
Thanks, Alba. I want to be mindful of time. I had one more kind of practical question I thought I might pose, and Benjamin, maybe you're the one to take this one, but Miriam in Ethiopia asked how countries can manage integrating COVID vaccines into routine services when there's such a short vaccine shelf life, and if there's any guidance on that.
Yeah, that's a good question. Shelf life, I mean, the manufacturers are looking at updating some of the shelf lives, right? So, and we do hope that, and we do know some of the vaccines have different shelf life durations. So it is true that there was benefit to roll them out through campaigns because of the short shelf life. But I do think if you have, most of them have now over 9 months and 12 months of shelf life, I think. But I can check on this, and there's guidance on this available. But that means you can start having a little bit of a predictable approach on how you store and provide the supplies to the lower levels based on the shelf life and the number of deliveries you do either per week or per month to the lower levels. So I hope this can be taken into account, but it's a good point that needs to be addressed when you look into the specifics. You need to really be clear on the shelf life and how long it takes to get the vaccine from the national level all the way to the lowest level. Over.
Thank you. I want to just sort of summarize a few of the things in the chat and questions that are coming up that I think are very important around demand generation. There's a lot of comments about how demand generation is really key in all of this, especially in areas where there's a significant amount of vaccine hesitancy still, and where in some cases that vaccine hesitancy has spread to other vaccines. And so there's really need for integration there. We did put in the chat the recently published operational framework for demand promotion, which provides a lot of resources and really practical examples of how countries are already doing this. So I really recommend you look at that. but I think this is an area for future conversation. And on that note, I was going to move to the next couple of slides that just summarize some of the resources and ways that you can communicate with us to give us some feedback about additional information you all need. Next slide, please. So Knowledge Success is collecting and publishing a number of integration related resources. This is our QR code to our main page, and we'll put it in the chat as well. Many of you have contributed to these resources, so I want to first thank all the partners who have been in interviews with us and sent us documentation and sent us key resources. We're really trying to feature all of your excellent work as examples and curate them here. Next slide. We have an integration blog series that is about half published at this point. We are trying to highlight at least one excellent country project example for each of the building blocks. We already have several published, as you can see here, and we have more to come in the coming weeks. So you can follow those on that same Knowledge Success COVID page. And we're really trying to use those as a way to get at the how do I do this, these really practical lessons learned that could be applied in other countries. Next slide. We also have developed 2 essential resource collections thus far, and we have 2 more coming. One is on reaching high priority populations with the COVID-19 vaccine, and many of your products are featured in here. We also have a recently published collection on data management and digital health, and the collections on resilient supply chains and integration are forthcoming. So all of the key resources we've talked about today will be in that integration collection, as well as many others. Next slide. You may have also seen various announcements that we are preparing a supplement for the Global Health Science and Practice Journal, specifically on integration of COVID-19 into primary healthcare. Look for that to be published in December. We are working on manuscripts now, and some of the papers that are likely to be included include integration planning and strategic planning, supply chain management, electronic data management, demand generation and misinformation, and much more. Next slide. As we've said, we have another webinar in this series a week from today, Thursday, the 27th. And in that one, we're going to be featuring lessons learned from an integrated digital health information system in South Africa and the broader project that has been integrating really across all of the building blocks. Please register for that today. Finally, we are going to be sending a link to today's recorded presentation to the slides, and that will include all of the links to the resources we've talked about today. I want to thank hugely the presenters and the organizers that have helped us plan today. Thank you so much, Beth Tritter, to Alba from WHO, Benjamin and Dr. Mirza from UNICEF, our USAID COVID response team who's been working with those UNICEF and WHO folks so closely to prepare this guidance and get the word out to all of you. If you have questions for any of the presenters or for this group as a whole, please go ahead and email me and I'll connect you to the right person. And then finally, before signing off, please take 2 minutes to answer the poll questions that are going to come on the screen right now. These will be anonymous. This is just a way for you to communicate to us what additional topics you would like to see us cover, what needs you have in terms of integration. So these results are anonymous and will only be shared with the organizers, but will really help us plan future products. So please do take a minute and answer just 4 questions. And when you're done, please feel free to sign off. And again, thank you to all the presenters and all of you who have joined from across the world today. Those of you still on the line, please do take a moment to answer the 4 poll questions by clicking on your selected response and scrolling down for the 4 questions.